We as human beings are very conservative, driven for survival, not always performance. That's why when you chase performance, there are repercussions to it. There are trade-offs you make to the high level.
Me.
Yeah,
that's how we met.
Exactly, right?
When I had my knee surgery, we worked diligently together to like get me back through that. Then you had to go and have a baby and disappear on me, and it all went downhill after that.
I think at the end of the day, if it's not going to harm you, it's not bad to try. But I think the spreading of misinformation is this is the best thing for everybody. That's the problem.
There's a lot of fear mongering, and there's a lot of Instagram reels that are out 100%. There telling you this is exactly the way to do it. And I always just say you got to work on your intuition. Fighters are delusional as hell.
100%.
Like we have to be. We just believe it's gonna happen, and then 100%. Sometimes you're like, how do we know it was gonna happen and it doesn't happen? And we get surprised, and then you have to deal with all that, and there's other things you unpack with that. But there's so much power in that, in the belief. Welcome to the Built for Growth podcast, a place that I have dedicated to motivating, empowering, and elevating you through knowledge and shared experiences to be the best version of yourself. So come along with me and my amazing guests who are here to inspire you and I in all the ways. If you are ready to grow above and beyond, then this is the podcast for you. You know when you find a provider of sorts, whether that be a doctor or a dentist or a therapist or whoever, but this person is special and unique, and you always look forward to your interactions because they leave you feeling comprehensively better because they just go above and beyond. That is the relationship that I am fortunate enough to have with today's guest, who is a leading physical therapist in Las Vegas. Dr. Zaki Afzal helps active adults, athletes, and lifters get rid of pain and get back to the workouts and sports that they love without pain, medications, injections, or surgeries. And in my case, this held absolutely true, as I share in detail during this episode how Dr. Zaki saved me from a scheduled surgery that I did not need, despite the recommendations for surgery from many medical professionals. And I'm so glad that I found Dr. Zaki in the nick of time, and how he healed an injury that no other therapist or doctor had been able to do. Zaki takes pride in keeping active adults, athletes, and lifters on the top of their game. His goal is to keep them working out so they can be fit and active and live that lifestyle that they desire. Dr. Zaki founded Optimized Physical Therapy and Performance out of this simple need to make sure that no one has to suffer through the pain or lack of high quality care like he did, and myself included. I'll throw myself in that too. Too often, people don't get the care that they need. And in today's profit-centered healthcare system, well, today we get into all of that and more. So, as always, thanks for listening. Today's episode is brought to you by Timeline's Mitopure Gummies, a strawberry-flavored dose of cellular energy. And if you haven't heard about cellular energy, you're missing out. I feel like it's the missing link for so many people, and I'm going to talk more about it. So listen up, and thank you to Timeline for making this episode possible. Thanks for coming in today, Dr. Zaki. I appreciate it. And I can't wait to get into all the history that you and I have together. I feel like it's all been injury-based, which is unfortunate. But but you saved me from surgery. And so I'm going to start with that.
Sure.
So the history here is that, when was it? What year was this? Let's see, 2000. Do you remember what year it was?
It had to have been last year, right?
Well, that was the knee thing, but the ankle was more.
It was end of 2023 then.
Okay. Mm-hmm. So I remember I kept rolling my ankle, and I thought I had this, irreversible damage. Right. I had been explained that the ligaments and tendons, whatever, just over time they stretch out, and that I probably just need surgery to like tighten those back down again, and that was my issue. And I remember when I came to you, you're like, no, like think about a chicken, like, tendon, like hang a weight on it. Like it doesn't stretch. Yeah. Right. It either tears or you explain that they can be like cottage cheese holes, and you kind of like, it can get weaker.
Yeah.
Not cottage cheese.
Swiss cheese.
There we go. That was the one. Swiss cheese. Then you explained it in a way that made sense. And I'm always very inquisitive. I ask a million questions about, I want to know why and how the body works in every single way. But you've always been able to explain it really well to me. And where I want to dive into this is that I actually had surgery scheduled. Mm-hmm. And then I went and saw you, and it was like very quickly, your advice and your work changed everything. And I have absolutely no problem with my ankle today.
Yeah.
Not even one iota.
That's awesome.
So can you re-explain like kind of what happened and why,
Sure.
People might be being misled into surgery when the problem is actually, what would you say, neurological or your nervous system?
Yeah, I think a big part of it is that folks a lot of times will take a complex problem and try to give it as simple as a solution as possible, where, sometimes it's good to give a simple solution, right? Sometimes we're in a predicament where we have all this vast medical knowledge in our brain and we have to be able to transmit it to the patient so they can understand what's going on. And sometimes it gets dumbed down a little bit too much, especially with someone as intelligent as yourself. And it leads them down a path with the dumbed down information. You can only make a lot of times dumbed down decisions, right? And neurological is a good way to put it. At the end of the day, the nervous system, the brain, the spinal cord, the nerves, a lot of times is going to be the thing that dictates what your body feels like, and a lot of times our motor output. We've all had those days where you want to go work out, you want to go do something, your body just isn't responding. And sometimes it's a protective mechanism. The body lays down, letting you know, hey, you need to take a break a little bit. And sometimes, people try to pin down on it like, oh, maybe, I have a physical issue here or a biomechanical issue here. And sometimes it's not that. Sometimes it is the nervous system just giving you a little bit of a sign. And I think ideally a good physical therapist, good chiropractor, good physical medicine practitioner is in a way a translator of the body's nervous system, right? It's speaking a language that we don't understand, like at the end of the day, my nervous system doesn't speak English. It's not telling me take a rest, but it's giving me signs. And I think what a good practitioner will tell you is how to look at those signs, translate them to something you do understand and what actionable things you should do. So for your ankle specifically, it was a neurological thing. It was a thing that the ankle just didn't have a great idea of where it was in space. And the ability for you to get to the inside edge of the foot was kind of limited, right? So imagine you live on the edge of a cliff, right? Your chances of falling off that cliff are a lot higher than if you just moved over, 10 meters, right? So it's one of those things. So if you live on the edge, there's sometimes reasons to kind of live on that edge, but most of the times it's good to kind of find that middle ground. And that's kind of what we helped you find. We opened up space in your foot to where you can find that inside edge of the foot. And that's where a lot of internal rotation gets driven into the ground. And that's our force production mechanism of how we actually push a downforce into the ground. And once you found that, a lot of times the body kind of recalibrates itself and it kind of self-organizes. That's what's so smart about the body. It can self-organize if you give it the right stuff. We've been talking about our kids a bunch. It's very similar to like a Montessori kind of approach to teaching the kids, right? Like
learner-driven.
Exactly, learner-driven. And like we have to give the body room to make mistakes. We have to give the person room to make mistakes because that's a lot of times where you learn best. Mm-hmm. And I feel like when you get the tools, now it's time to explore and find the body can kind of self-organize there.
That's so good. If you're anything like me, then you're always on the go. I'm always training, parenting, podcasting, and throw it on the list. I got it. But you and I both know how important it is to keep your energy up and recover fast. That's why I have been loving these MitoPure gummies from Timeline. The only clinically proven urolithin A gummy shown to improve cellular energy and muscle strength. This postbiotic targets age-related decline at its source, your cells. And the benefits are impressive. And they are tasty. Only 10 calories, and they are Clean Label Project certified, NSF content certified, and free of major allergens, non-GMO, no artificial ingredients. Oh, and MitoPure is the only clinically proven form of urolithin A. You just pop 2 a day, but actually I was really excited when I was reading the back and I realized you can take up to 4 a day. So you're good to go with 2. I take 4 because they are delectable. A real treat. So if you're looking for a real way to boost your daily energy and stay strong, this is definitely worth the delicious try. My friends at Timeline are offering 20% off just for my listeners. Head on over to timeline.com/Miesha to get started. That's timeline.com/MIESHA. Talk about what the nervous system is responsible for, because I feel like that's just something, as we say it and we assume that everybody understands, but I still even find some mystery in this nervous system. But I know it's important.
Sure. Yeah. So basically the nervous system is responsible for almost every action your body does, right? So you have the sympathetic nervous system, you obviously have the parasympathetic nervous system. What that drives is your alertness and awareness, or the time for you to kind of rest and digest. So if you think of all the systems that can be kind of affected by anxiety or high-driven awareness, it's every system in the body. Your muscles tense up, your pupils dilate, your lungs kind of dilate. It's time for you to fight or flight, right? And then the parasympathetic nervous system is the opposite, right? So all the opposite things happen of what I just kind of spoke about. So it speaks to every part of the body. There's also autonomic nervous system, which is basically everything you don't have to think about. It has to be regulated somewhat, right? The thing with the brain is that if you have to use conscious thought for everything to happen, one, you probably don't have enough processing power to take care of everything the body's undergoing at a physiological kind of level. But also, it'd be really slow. Because everyone thinks of like nerve endings and nerve signals as really quick, because it is like lightning, right? It's like electricity signals passing through the brain and through the body. But if there's a reason why reflexes exist, right? Where that information enters the body, only has to go to the spine, and then goes back down to the body part to accomplish the task. Like a really good one is like a stumble reflex, right? When you're falling forward and your leg automatically kicks out in front of you, if it took you time for that information to go to the brain, then come back down, you'd fall on your face almost every single time.
So it was only going to the spine and then it's coming back out.
It's coming back down.
That's what a reflex is.
That's what reflexes do.
Okay.
So that's why, like, when you go to the doctor and they check your knee, the knee jerk reflex, that's checking your L3, L4 spinal cord level more so than it is anything to do with your brain, right? A lot of folks that have even like issues with brain, like what is like a TBI, traumatic brain injury, a lot of times their reflexes are still active and sometimes overactive, because the brain, everyone thinks of it as like this big control center. Nothing happens without it. It's absolutely a vital part of what happens in the body, but it's not this control center which looks over everything. It's a vital part of it. It can process a ton of information. It's really good for like memory consolidation and recall, but it's not absolutely necessary for every single thing we do.
This makes me wonder, do you know that like if the body would respond differently, like let's use the sprinting, for example, and maybe there's a better situation in this, but like a high pressure situation versus a low pressure situation mechanically. Because you talk about reflexes, and I think about fighting and I think about muscle memory, but there's also a lot of things that are reflex, but it's a high pressure situation. And so sometimes, let's say, if you were going to go and work out and you're not anxious or, you don't really think you're being chased by a tiger or anything, right? So you're just going to go out and you're going to sprint. Does the body move differently under like a stressful like situation versus like a relaxed situation, even if it's like you're trying to summon the same thing?
Yes. So that's a great question, and that's absolutely 100% true. There's, situations that we've heard of. You've heard of the stories of moms lifting cars off of their babies and stuff like that. But it's absolutely true, and there's tons of evidence of those situations occurring in everyday life. Like if you this is like for my basketball fans, like if you see Shaq shoot free throws in the gym, he shoots a pretty decent percentage, like 70-80%. You put him in front of a crowd, and now that free throw percentage drops. Now a lot of people, he's worked with every free throw coach in the country. Oh, his hands are too big to shoot free throws. Well, why can he shoot them in the gym better than he can in front of a crowd? Now, I'm not saying Shaq is this nervous guy, he can't live up to the pressure. It's just a different way for the brain to process that information. And absolutely, it's true. Like when there's been studies done on it where, there was a study done where they took somebody and a group of people and they brought him on an exercise bike and said, hey, ride this certain distance as fast as you possibly can. They rode it, they got really tired, they were finished. 1 or 2 days later, they brought them back in. So in that time span, you don't have enough time to really physiologically change your body to be faster. But what they did on the screen, they said, hey, instead of riding it fast, just beat this person on the screen. And then they have to ride fast enough. Almost every single person beat that person. And who that person was actually them 2 days ago.
Oh,
right?
Wow.
So it's crazy to think about, like there's so much inhibition coming from the brain. And it's really because we as human beings are very conservative. We're driven for survival, not always performance. That's why when you chase performance, kind of like you have in the octagon, there are repercussions to it, right? There are trade-offs you make to the high level.
Me.
Yeah,
that's how we met.
Exactly, right? There's trade-offs you make, and like if you like health and performance, they live on a spectrum, and if you're chasing like optimal health or optimal performance, generally there's a trade-off. Now, if you're not looking to be elite, then there's absolutely a way for you to be completely healthy and feel pretty good and have high level performance. But usually those elite athletes have to make a trade-off. And like when you look at like a big example that I use here is look at like LeBron James' feet. Right? People saw him on a vacation one day and they saw him with us and his toes are all clawed up and like it's a very narrow foot. It's very but that's what makes that foot come off the ground really quick like a spring versus having to like, flex into the ground, then come out. It makes him much more explosive off the ground. That's what we call the performance foot. So if you're okay with those trade-offs and you're aware of them, then it's your choice whether or not you want to make that trade-off or not. Maybe with under the guidance of a health professional, sure. But that's the thing is like, there are plenty of inhibitions the nervous system is built in just to keep you kind of there, right? Its priority is survival. Its priority is, making sure you breathe, making sure you sleep, making sure you have food. So a lot of things are driven by those basic desires of the body. Mm-hmm. And one of the big reasons we have a nervous system is for protection. Usually reasons that we have, like sleep deprivation, there's symptoms with it, right? Why are there symptoms when I don't sleep, right? I could just not sleep and feel the same. But the reason I have those symptoms is because my body wants to tell me, hey, you probably want to make a little bit of a change. But for short periods of time, anybody can really survive in almost any condition. Over long periods of time where the body starts adapting to it, that's where we see some negative repercussions of those choices.
Let's talk a little bit about the shape of the foot then, and the use of the foot, because that was a game changer for me, moving to the inside of my feet. And it's so funny. I still randomly think about you often. I'll be standing in my kitchen barefoot or anywhere in the house, but I'm usually in the kitchen. And I'll just press all of a sudden realize I'm on the outsides of my feet, and I'll just press my feet to like neutral or to the inside just to kind of give it's more of like that cueing of my memory of like, hey, this is where we want to be. We want to be at least like here and definitely when I'm trying to be athletic in the gym, that made a huge difference on my shot times. Mm-hmm. Huge difference, because when you, as an athlete, I'll speak from experience, are on the outsides of your feet, your reaction time is just much slower. 100%. I realize that the bones need to align over themselves in the direction that you want to go, so the muscles can kind of propel and everything has to work. But so there's an extreme lag time if you've got to shift your weight from the outside and then you try to go to the inside, and then you don't have that spring. You don't have the
drive.
Tension sort of in the ankle. It's just kind of loose, or it's on the outside already, which is just like the opposite. It's like trying to turn right while you turn left. It's like not working for you. So maybe talk a little bit about that from why that's important. And is it important for like everyday people not tend to be on the insides of their feet enough?
Yeah, great question. Yeah. So with that, it depends on what task you're trying to accomplish, right? I would say for everyday people, I think the reliance on biomechanics for everyday people to solve their like pain problems, it's probably a little over reliance on biomechanics, right? When the forces get higher, biomechanics become more important, right? There's always going to be a better way.
By biomechanics, you obviously mean movement.
In which way you're moving, like stacking and looking at joint angles and stuff like that, because there's always going to be a better way to jump off a roof. Right? But if I'm going up and down stairs, a million different ways I could do it. If I'm walking in the mall, a million different ways I can do it. And there's no real right way, right? At the end of the day, the body's collecting information of its surroundings, and there's a task at hand, right? I'm sure you've drilled specific kicks and strikes and takedowns and shots in the octagon and training a ton. And then when the fight comes, you might watch your tape back like, why did I shoot that way? It's because it's a completely different situation than you were prepared for, right?
Yes,
so your body makes
pressure.
Exactly. Your body makes the best decision at the time with the tools it has and the time it has. When you have plenty of time, your body can really, do what you want it to. But what we are trying to train a lot of times when it comes to the foot is the ability to kind of offload pressure and hit multiple options, right? A lot of times options lead to more variability, meaning that if I have the option to go inside or outside of my foot, now I have the option to have different changes up the stream at my hip and my knee and my back and all these other things. If I only have one position of the foot, which is kind of where you were living, it wasn't that where you were living was wrong on the outside part of the foot. And so I don't want that to be misconstrued. It's that you were doing everything on the outside part of the foot where some things are better done on the outside of the foot. If you wanted to squat straight down and just have more of a vertical squat, outside of the foot sometimes can help. But when you want the ability to push force into the ground and feel some stability, inside of the foot generally is a better driver of that, to push force down into the ground. And that's what you were missing. So that's what we reintroduced. If we go back to LeBron's foot being shaped a specific way for his specific tasks, if I took his foot and made it much more mobile, he might lose some explosiveness, right? So that's the trade-off, like I said, he made for performance versus health. So outside of the foot generally is what we call supination, which is generally a little bit more of a rigid foot, a foot that has less like almost length to it as well. Pronation is how we get to the inside part of the foot, and it all comes from bones in our midfoot that are actually opening or closing or rotating as we kind of move. And where there's joints, generally there needs to be some movement, right? And like I said, if there's a purposeful trade-off to restrict that movement, and another example of that besides LeBron's foot is like a power lifter. Their spines get incredibly stiff because if I'm lifting 700 pounds off the ground in a deadlift,
and your spine's flexible.
Yeah, you're not going to lift it. Exactly. You're not going to lift it, right? So something is going to bend before. So I want a little bit of a stiffer spine. So these are things that if you are intentional about and understand and aware of and make that decision, that's your decision. But I think what I'm trying to do is I'm trying to help people understand those decisions better, because a lot of times they're given misinformation and that can lead them down a bad path.
Yeah, it's so good. And this is why I think you're so great at working with athletes in particular.
Yeah.
So you made a lot of sense for me. And I remember that one of my symptoms was that my biggest complaint was that my ankle felt on the outside of the ankle. Is it the tendon that's running there? Tendon or ligament? I always forget those.
There's a little bit of both.
Both.
For you, it was more tendon.
Yeah. That I felt like my ankle was really weak, but really tight. So it felt like I had no stability. So I would roll it at the drop of a hat, but it felt so tight that I was afraid that I was going to snap something.
Yeah.
So I was like, I don't understand how it can be tight and loose at the same time.
Right.
But this is what's going on.
Right.
So kind of describe to me a little bit why that's a symptom,
Sure.
and then like how we actually fix that a little bit.
Sure.
Yeah.
So to my best understanding, what happens with muscles and tendons, any soft tissue structure that runs in a series, meaning like runs in a lengthwise kind of way, is that when you are putting tension on it, it's going to feel tight. Tightness doesn't always mean like short and coming together. You can feel tightness in a stretch, right? And when you're on the outside part of the foot, the outside part of the ankle, the tendon you're referring to is the posterior tibialis tendon. That is in a stretch as your foot kind of inverts a little bit. That goes on a stretch because it's on the outside part of the ankle.
It's constantly having tension on it because I was living on the outside of my foot.
Exactly.
Right.
And then from there, what ends? Sorry, I said the wrong tendon. It was the fibularis tendons, not the posterior tibialis. So those are on the outside part of the foot. And then from there, what ends up happening is that weakness you feel a lot of times is because when you're resting on the outside part of your foot, the length tension relationship of your muscle isn't necessarily in a place where it can contract quickly. So for example, if I take a muscle, so muscles are kind of linked this way in what we call sarcomeres, right? For them to shorten, these have to kind of come closer together, sarcomeres in series. And then as they lengthen, they kind of come further apart. When you're living in a place where they're further apart, it's going to be harder for them to pull back together sometimes. There's a length tension relationship that's optimal, that if you hang out with, most force can be produced there. That's what I mean by optimal. Not that it's right and everything else is wrong, but just highest force production capability. And you were living so far away from that. That's why it felt weak, because it's not responsive, because it's hanging out in that stretched position. Some muscles, for example, like the hamstrings, actually have a length tension relationship that's optimal for force in a longer position. So that's why, sprinters, before they start sprinting, they actually, they're in the blocks and their butt goes up. And then that lengthens the hamstring. They can use it as a spring to push forward. The fibularis tendons on the outside part of the ankle are not necessarily for that. So every muscle is a little bit different, but that's generally why those symptoms can kind of be together. It's like it's tight because it's being pulled longer,
right,
and it's weak because it's being pulled longer. Tight doesn't always mean being pulled together and short.
Right. And then the way that we started to move through this was to show my mind, my nervous system, my body collectively another option,
yes,
so to speak. And so it was like this, I liken it to like rewiring
absolutely
my brain and movement.
Yeah, and it's not physically rewiring, but it is relearning that pattern, because it's like, you have the hardware of the computer. We're just reteaching it the new software. We're downloading a newer version of Adobe, whatever you're using on there, right? The new updated firmware, whatever we're talking about, that's what we're kind of trying to download. And the body is amazing at that, at relearning things and even unlearning things, because as long as it's put in the right environment to do that and given the right stimulus, it can always do that. There's a reason why, if you want long-term memory retention, like say you're in school studying for an exam, if you're cramming during that time, after the test, you're not going to remember any of the stuff you studied. That's not, so it's a stressful situation. Your task is just pass the test. Your task wasn't to learn. Because long-term memory consolidation and motor learning comes from recalling under some kind of stress. Now, too much stress, not going to learn. Too little stress, it's not enough challenge. You have to find that middle spot where we're challenging the body enough to make those changes and adapt, but not challenging it too much where it's too hard and it fails all the time. So, and that goes true for every single thing you learn. That goes true when you're trying to teach your kids a new skill or sport or math or whatever it is. Has to be enough challenge where they're showing positive adaptations, but not enough where they kind of shut down and don't want to do it and fail too much.
That's why I love Apogee so much. I'm probably bringing that up, but
right.
But they understand that kids learn best through play.
Yes.
But I think because of play presents a challenge usually, and it's like a little bit of like, oh, I want to win or I want to do this.
Yeah.
But it's like science. It's like what it makes sense, right?
Absolutely.
Kids, like, put a challenge out there if you want them to learn, but it needs to be not too stressful, like cracking a ruler and being like, you gotta memorize this. Oh, it makes so much sense. Yeah. Okay, how about like fluid in the body, emaciation, and the spine? This is kind of the direction that I want to go. So like, so when I had my knee surgery, tore my LCL, tore my PCL. We worked diligently together to like get me back through that. Then you had to go and have a baby and disappear on me, and it all went downhill after that.
I was just telling someone about that the other day. I felt so bad, but
it's okay. You got to live your life. You're forgiven. But what was I going to say? Okay, so the process of emaciation is so interesting to me. And I remember you telling me in one of our conversations about how the body kind of stops sending, I don't know, in my recollection, it was like when the messaging kind of stops or gets interrupted or isn't congruent, like the leg is just stationary, the body stops putting as much fluid there. And like fluid is important, like that, like the fullness of the muscle. I might probably not describing this the right way, but I think I cued you in enough on that. Yeah. And then it also kind of cued me into the spine, because I know sometimes people have a degenerative disc, and we talked a little bit about that, how sometimes it can be like a more of a fluid thing, right? Am I saying this right? Okay.
I remember this conversation.
Let me hand it to the pro.
Yeah. So with the fluid we're kind of talking about is that in the joints themselves, they're what we call synovial fluid, right? That's how the joint gets fed. It has nutrition, has the ability for the joint surfaces and the cartilage and everything to stay healthy. To get that fluid in and out, there needs to be movement. There needs to be some kind of pressure gradient that pushes the fluid in and out, and bring new nutrients to the area. And that's why joints that move stay healthy. Joints that don't move generally have some deterioration. Now, the crazy part about degenerative disc disease in the spine is that it probably has something to do with the fluid retention in the spine. But it's more and more in the science, when you look at it, it's almost becoming just normal for degenerative disc disease to happen, and like where it's not even a disease process.
So hard to hear.
It's crazy because after I got married, 2 kids, I started getting some whites in my hair. Right? If someone came up to me and said,
happen to you.
Yeah, I know. And if somebody came up to me and said I had degenerative hair disease, I'd be like, what the hell? It's just white hair. That's kind of what it's akin to in the body. It's just signs of aging. It's not good. It's not bad. It's just what your body looks like as you go through. And we know that now because we've done studies on MRIs and X-rays and found that as your age group goes higher, whether you have low back pain or not, and this is all in people that have 0 low back pain, as your age goes higher, your prevalence of degenerative disc disease goes higher. Same thing with white hair, same thing with wrinkles, same thing with all the stuff that's just signs of aging and not necessarily a bad thing. Now, when we talk about fluid, I think the most important thing to understand is that air is also fluid, right? The body is filled with air. We're basically, a skin is basically a container for fluid. We're containers. And how our body pressurizes and moves it has to follow the law of fluid dynamics. Has to. We're mostly fluid. We're mostly air and water and other fluid. And if we don't consider that in movement biomechanics and movement restoration and stuff we work on, I think we're missing a big mark. Right? Mm-hmm. How the air moves. Can it get into areas of the rib cage? Can your foot move? Can we pressurize and contain pressure versus can we open that container and expand into areas? Those are all fluid dynamics that are kind of a central thesis to how myself and all my therapists look at movement. And I think it's something that is very undertaught. Maybe in the future it'll get more prevalent. But in physical therapy school, we didn't learn any of this stuff about how to assess movement. But I'm not blaming the schools because they're there for a reason. They're there to make you very safe and a very good general practitioner, because you might want to work in a hospital. You might want to work in a nursing home or do home health. You might want to work where I'm working, right? But you have to be able to pass the exam as well. So they're not there to make you a specialist. They're there to make you a generalist over everything. And then from there, it's your job to be very good at what you do. And I think one of the biggest things that kind of took us that way, and like kind of the pioneer behind this thought process is a man named Bill Hartman. He's a physical therapist. I think he's out of Indianapolis, but he kind of made out this model of human movement that we kind of subscribe to. I teach all my clinicians this stuff, and his stuff is very, very in-depth, but it's very, very neurologically backed and biomechanically backed. And it might not have a randomized control trial that tells you exactly do this from this study, but it's based in science and based on things that we've learned and unlearned over time, because I think we sometimes discount the things like from 50, 60, 70 years ago. Like, these people weren't stupid. Like, why do we say, hey, just because that study was out 50 years ago, that information doesn't matter anymore? I think that's a big issue that we're running into in academia. And back in the day, how they used to organize people is by their shape. So like, they would say, people shaped like this, wider rib cage, wider this, you're more prone to this. People shaped like this are more prone to this. And that's how we utilize shape in our methodology now as well. So like, it's kind of pulling from how we used to do things back in the day and not throwing the baby out with the bathwater. Now, of course, back in the day, they did a lot of stuff wrong. They didn't wash their hands. They used the surgery, everything. Like it was a lot of things wrong. But now, like, we're learning the things we can still utilize, and then maybe things that we can also improve on.
Yeah, those made me think way, way back in the day. I know it was like common practice to drain the blood out of a sick person.
Yeah.
Right?
Yeah, crazy.
Oh my gosh, thinking you were cleansing and
Oh. And I feel like even that's gone a little like far too in today's health and fitness kind of world, is like the idea of a cleanse, right? I think a lot of the cleanses have much more to do with like the fact that you're fasting and the fact that you're, mentally like doing something challenging more so than it is like that specific juice is changing everything. Because like realistically, our livers and our kidneys are really, really great cleansers, right? They're there for that exact reason. If they didn't do their jobs as cleansing the body, we wouldn't really be alive. We'd have way more disease processes right off the bat. Mm-hmm. Now, I'm not saying like, juice cleanses or fruit cleanses have no place, but I think understanding what they're there for is really important, just so we don't take it too far and we actually can maximize the benefit of doing something like that. Yeah. Like I said, because of the challenge we're mentally putting on ourselves, but then also because of the fasting. Like when you look at the research behind and I'm not a nutritionist, but when you're looking at the research behind fasting, there's a lot of really cool benefits the body gets in terms of like refreshing the immune system and like even like sometimes slowing down cancer cell growth. A lot of really cool things, and even with your insulin regulation and stuff, there's a lot of cool benefits to it. So I do think fasting is a really cool thing to implement, and I think that's what cleanses kind of do, is they force you to fast just in a little different of a way.
Yeah, definitely. Maybe a little break on your digestive tract. I think sometimes people like to do that too.
Absolutely.
Just to give it, not processing food. And,
exactly. Yeah, give the gut microbiome a little bit different, something different. So they're not, so it's very similar to how we were talking about restoring options in the foot. You're living out here, let's bring you back here. It's going to get your body to regulate. Very similar, right? Yeah. So, it's like it's a place where, like I said, I'm not a foremost expert on the nutrition side, but I've done enough research where I can at least understand that, we do have to be pretty kind of choosy with which direction we go. And I think at the end of the day, if it's not going to harm you, it's not bad to try, right? But I think the spreading of misinformation is this is the best thing for everybody. Right. That's the problem.
There's a lot of fear mongering, and there's a lot of, Instagram reels that are out 100%. There telling you this is exactly the way to do it. And I always just say, you got to work on your intuition. Like you got to listen to your body. And interesting, there's a lot of research coming. Do you know who Dr. Stacy Sims is?
I do not.
I wouldn't imagine she would be necessarily in your immediate circle of things that you're doing, but she is leading a lot of research on women and our cycles and how everything is affected differently, because most of the research is done on men. And even so, I went to speak. We'll get a little off topic here, but I went to speak at UCLA at a brain trauma conference, and I was sitting and, picking the brains, as I do with everybody that I, smarter than me. I'm always trying to learn something of the scientists there that study the microglia, I think that's what they called it, of the brain and trauma and how things are affected when you get brain trauma. So they study mice, and, they knock the mice out and they hit them in the head and they study all these things. It's fascinating.
Yeah.
But they told me that the way that they get their funding, it is required that they study females, right? So female mice.
Sure.
But a lot of times the data can be so skewed depending on the female's cycle that the data is completely different depending on that. Not necessarily just for brain trauma. I don't want to misquote, but in many things that the way research is done, they were telling me the way a lot of research is done is that they will actually sterilize the female mice.
Oh, wow.
And get rid of their estrous cycle so that they can get it to be congruent data.
Sure.
Just depending on, where the female's in a cycle is completely different. So then it messes up the male data and it also isn't accurate for the females. So I thought that was really good information to know, that as a woman, we can't always just say, well, this study was done and, for men and for women, or for, in these mice that included females. We just have to understand that there's always more to it. And I think the best thing, honestly, is take your information in, take it for what it is, try it out, and see how you feel with it. Because fasting for women, really what I've come to understand, is completely different than for men. Yeah. You're on a 24-hour hormone cycle. Right. I'm on a 28-day hormone cycle, right? You get testosterone every 15 minutes. I get it once a month. Sure. We're just completely, in our biology, totally different. And there's times in the cycle for women, it's just not a good idea to fast. Yeah.
Absolutely. And I think that's a very, very good point. And that same research is kind of going to the orthopedic, in sports injury realm as well, where they've shown you have in certain parts of your cycle have more laxity in specific ligaments. They did this research on the ACL and found that depending on the part of the cycle you're on, you actually have a higher incidence of ACL injuries in young female athletes. So it is very important. Now, I think the hardest part about that is how do we apply it? Do we as sometimes basketball coaches for young female high schools are men? Do men be hey, what part of the cycle are you on?
They need to know.
I agree. I agree.
You know what we do at the PI now? We have this app. It's called Fitter Woman, FITR.
Okay.
And we track our cycles on it.
That's awesome.
And we share that information, openly. And I had a male trainer first, and then he moved away. Now I have a female trainer. But either way, I'm look, we got to grow up here.
100%.
Women have periods.
I agree.
It's not the end of the world. This is how we make humans where you came from.
Absolutely.
It's normal. Can we just normalize it? Right. But how they implement it is just things let's say we were going to do box jumps. Yeah. We just wouldn't do that during the time when you try to eliminate the things that could potentially put stress on. And for me, I can make smarter decisions too and say oh, maybe today is not the day that I go and do an 11 out of 10 workout. I'm not going to spar today, or I'm not going to do wrestling. I'm going to do something controlled instead. I'm still going to get my great workout, but I'm going to do, we call these things sickos, but it's controlled where it's you're pushing yourself and every minute you've got a new cycle and, you're going hard, but nothing is uncalculated. Sure. And so these things can help women make better decisions about what they're doing with their body and how controlled is the atmosphere and the movements they're doing when your ligaments are in a a loosened state.
100%. And I guess the thing I was trying to bring up is we do have to normalize it. That's how we do implement it. And I know that if you told a high school coach that doesn't have a lot of information behind this and how to traverse this kind of sensitive subject.
Yeah, especially for young girls, because that is very awkward.
It's just their first time. They don't know anything about it. They're just getting into that cycle. So it's it's a tough thing. And I think, like you said, normalizing it and not sexualizing it is the way to go. And it's just that's just a bigger issue than I can solve. That's like change the whole country. You know what I mean? And it's like, it's one of those things that like you can do it step by step. And I think that the way the PI is doing it is phenomenal. I think the way you guys are tracking it is great, and utilizing it is not the only thing you're making decisions by, but at least a piece of the puzzle, right? I think anytime you rely on one piece of information and make all your decisions on, you're probably going to be a little lost. But once you could put it in this like puzzle of like, okay, I'm working with Miesha Tate, the human being, not Miesha Tate, the cycle, not Miesha Tate, the knee or the ankle, the human being, right? And I think that's where if medicine moved more towards that, of encapsulating you as a person with feelings, with a brain, with other things, I think that's when you'll start
feedback.
Getting, yes. And that's when you get compassion driven kind of care, and care that really will start like making you want to change your habits and making you want to understand yourself a little bit more. Because like I said, a lot of times people are looking for simple, even though the answer is a little complex. And sometimes simplifying is not the greatest thing. If I told you your ankle just because of strength, and then you just strengthen it, it didn't work, now you're going to go get surgery, right? So sometimes like looking at the complex picture and like simplifying, but not oversimplifying is the way to go.
Why do a lot of physical therapists who don't understand this think, and people, we're sold this all the time, and I think this is a problem with the insurance model. So I'd love to get into why you don't do insurance. I think it's actually great.
Yeah.
But why do we think that we just need to strengthen everything? Right? It's just like if it's just your ankle was just stronger, then it wouldn't be a problem anymore. It's like, okay, so why?
It's like a simplistic view of it, right? We know how to strengthen. We know we just have to push it to a certain capacity over a certain amount of sets, give it a little break, do it again. It's really simple and it's easy, right? I think in the past, strengthening something has shown pretty positive benefits in a lot of painful situations and injuries. But I don't think it's because you're stronger. I think the process of strengthening has things incorporated in it that allow you to improve. Because if it was the strength that got you to feel better, powerlifters and the strongest people in the world would not have pain. They would feel the best. And I know personally, they feel the worst, right? Even though they're really, really strong. So I think it's just simple. It's simple to say, hey, if it feels tight, stretch it. If it feels weak, strengthen it. And I will say, no one's ever been steered wrong by getting stronger, right? So I wouldn't say like it's a bad thing to get stronger, and it could potentially help, but looking at it for all your answers is not the greatest. And I will tell you, like in physical therapy school, generally that's how the therapeutic exercise was taught when I went from 2012 to 2015, was like, teaching you stretches, teaching you strengthening, which is important because you just learned anatomy. You want to learn how to apply it, how these muscles work. But I think there is a deeper understanding to movement and like the nervous system and movement patterns that are naturally built in, like the walking cycle, the running cycle. All those things are really important. And I think most physical therapists come out and they either jump right into a job and, looking for stability and looking for something to just pay the bills, and they're kind of get comfortable there. And a lot of times when they can't get the results they're looking for, like they're just chalk it up to, this person just didn't respond. Versus like, I probably could have changed something to get this person their movement back. And when I was first coming out, I had sleepless nights. I had nights where I'm like, oh man, I definitely messed that up. This guy's gonna go get surgery. Like I care that deeply about the people I work with. Like I would have sleepless nights. I couldn't think about anything else versus the mistakes I made, which I thought I made at least in that time. And what drove me really to go after more information was that feeling of like, man, I'm sitting here in this clinic and these people are coming to see me, but there's a clinic across the street that person's worked for 15 years. Why would they come see me? And I hated that feeling. And that from there drove me to do a residency.
Why did you hate that feeling?
Well, because I didn't know any better. My whole life, I was graded on my accomplishments. Did I get an A on this? Was I, did I win the basketball game? Did I do this? It was a competition between my brothers and sisters all the time, So my whole life, I was graded on accomplishments. And if I felt like if I wasn't excellent, I didn't even deserve to be in the room, right? And that's like one of my big driving internal drives that kind of pushed me towards the direction I went, which ended up good. Now I understand that's not always a healthy thing, but it did help me gain the information I needed to, become better at what I do. And I think that I honestly do think like some of that is a good thing to have. And I think that some physical therapists could probably do with a little bit more of that,
yeah.
right? Because I think you need something to drive you to want to become better, whether it's, your own internal motivation, somebody external doing it better than you, or you wanting to be like someone else. Like, I think those are good things to drive you to a certain extent. And I think that's probably why it happened. I was graded on my accomplishments all the time. That's what school teaches you, what's on your report card. And that's what I learned.
Yeah, no, it's so true. And it's I'm glad to hear that you found some balance in it all. You found a little homeostasis and in everything that you're doing, because you got kids now, they're going to be looking up to you, trying to be like, how do I do this right?
Right.
I want to circle back a little bit to the degenerative disc, because we kind of just we dismissed it a little bit as, potentially just aging. However, I think that there are some things that are told to people that you just got to live with this. It's just how it's never going to get better. But I feel like there are probably things that you can do to minimize the pain that potentially goes with it, right? And let's say somebody works a desk job from 9 to 5 and their back is just killing them, and the doctor goes, nothing you can do about it. It's degenerative disc. That's that's it. Like there are things that can do to minimize or at least the pain and symptoms and make it better.
Absolutely. And I guess since we kind of skipped over that, I wasn't necessarily trying to make the point that like it doesn't matter. What I'm trying to make the point is that it's not correlated with your symptoms. The symptoms can exist for sure. I'm not saying it's just in your head or anything like that. But there's absolutely things you can do. But I think focusing on trying to change the degenerative disc is where we kind of lose focus on what's really important. Right? Because if that's important, then I would have you re-X-ray every 3 months to make sure.
Okay, what technically is a degenerative disc, and what somebody might look at and say, okay, well, it looks like your disc is degenerate. There probably are people who walk around with degenerative disc disease that don't feel very bad.
Most of them, yeah.
Right. So, and may not even know that they have that because they feel relatively good and never even wanted to go and see a doctor. And then there are other people who may not even technically on an X-ray look as bad. But they feel terrible. Sure. So like, where is that line merging, and what is causing the symptoms of this?
So that's like a pretty deep rabbit hole we can jump into, and like what causes back pain. Because if I was just to like draw out a map of all the potential factors, we literally wouldn't have enough room on this table, even if I use like size 8 font. It's just like, it's so multifactorial. Like I've had folks that, and there's sometimes like a bigger driver in that multifactorial area,
like
but
maybe
like
a trauma or something.
Yeah, exactly. A trauma, or like sleep deprivation, or increased stress from a breakup, or things like that. I've had people come in.
Wow.
Yeah, it's crazy. Like how many of these things, and what we treat people as is that we use the biopsychosocial model. We incorporate the biological processes, but also have to look at the psychological influences and the social influences. I've had folks that had back pain that got better once they started going out and just going bowling with friends again. Right? That's aspects we have to look at with human beings. It's kind of circling back to like looking at Miesha as a whole human versus just as a back. And if we're trying to get like an answer on the degenerative disc disease, right? My like bottom line on that would be, it doesn't correlate to your symptoms almost at all. So us trying to change that is us missing the mark. There's probably other drivers to your symptoms that are going to be much more higher return on investment of us spending time there versus us sitting and trying to change something on an X-ray, right? So what I try to explain my patients as, if they do bring it up, I'll say, hey, this is like we talked about, it's like wrinkles or white hair inside the body, right? This realistically is just showing that you've been on this earth for a certain amount of time. It's like when you chop a tree down, there's rings on the inside, just counting it, right? Those rings have been in there. They're not doing anything negative to the tree. They're just in there, right? So what we're doing here is trying to change the reasons why the body might want to produce some symptoms here. Now, pain as a whole, many different reasons it can kind of come on, but generally it's the body wanting to change something, right? My goal is to see what physical changes can we make to lessen that output. A lot of people think pain is an input. A lot of people think we have pain receptors. We don't have such thing as pain receptors. Just like we don't have vision receptors in the eye. We have rods and cones that take light in. That information goes into the brain. The brain spits out what I see, right? So the brain is really important. Now, I remember we talked about movement. Like the brain wasn't like this big controller. When it comes to pain, it plays a much bigger role. right? At the end of the day, my body intakes all this information and then it spits out whether or not I'm going to have symptoms when the brain kind of processes that information.
Okay, we have to pause here for a second because this makes so much sense in a way, because I still have pain in my knee, and I'm like, there's nothing. I mean, like it's not what it was.
Yeah.
It probably never will be.
Yeah.
I still have a lot of crepitus, a lot of catching and things like that. But I get so annoyed sometimes when I'm just like doing a squat and I was like, why does it hurt? Like, I don't want it to hurt. I'm not trying to feed into like why. There's a surgeries a year and a half ago. Like, why do I still have pain?
Yeah.
I don't understand. And it's so frustrating sometimes.
Yeah.
So it's kind of going into what you're talking about.
Yeah, it's absolutely an output. And I think that, like, if you think about it this way, like, you would feel less pain in your knee if you're in a fight.
Right.
Adrenaline's going, everything.
Distracted,
right?
I literally told Johnny this before my last fight because I kind of I did something where my ankle, I hurt my ankle a little bit.
Yeah.
And it was like, it's not going to matter in the fight. I won't feel it.
Absolutely.
I was like, we're warming up right now. And it was, it was the week of, and and it just felt like a stabbing, like a pain. I was like, I don't know what it is, but nothing's wrong. And I won't feel it in the fight.
Yeah.
And I didn't.
Absolutely. Exactly. And the crazy part is the physical stressors on your ankle, on your knee in the fight are actually more than most of the stuff you're doing.
But I'm overriding
exactly.
The brain is being overridden.
And that's the way it's a powerful perspective shift you can make to show that, like, you are not broken, right? If you were broken, no matter what you did, you'd feel the symptoms. But it's the way the brain is processing what's going on down there, and almost a way of it being a little overprotective, right? Showing like, hey, there was a lot of trauma here. Like if I had a kid and if my son went on a roller coaster and like freaked out, now next time we go to a theme park, I might be a little more protective over him and be like, hey, don't go on this ride. This might have you freak out, right? So it's very similar. The brain works very similar to an overprotective parent. It remembers things. That's what it's there for. It remembers things, and even if you want to forget things, some things become ingrained in you. And there's ways to work through it for sure.
Maybe I need to go see a hypnotist.
It's funny.
Get rid of my knee pain.
Yeah, it's funny because it's very important, and people have done that with decent results. Like being able to work in whether it's like a mental health therapist or a hypnotist, people don't realize how much effect the brain has on everything you do. Like there's aspects of performance that can improve just by believing in yourself. Like you would jump higher if you spend time having mindfulness and in your mind having a vision of jumping higher. Over 12 weeks, you physically jump higher. You physically will run faster if you do that. And it's I wouldn't look at it as much of an obstacle as I would look at it as an opportunity. As an opportunity to tap into the brain and figure out ways that I can get better without even having to put any physical stressors on my body, but get physically better.
Yeah. I heard about a study that was done with, the jump, I think of, was it the jump or the free throws? It was free throws. There's two studies that mix them up. Anyways, it was free throws, and it was one group physically practiced the free throws for a certain amount of time, and the other group just visualized it. And the ones that visualized actually did better than the ones that physically practiced. Granted, they all played basketball, but for this period of time.
Yeah.
So I know what you're saying is true, and I know that it's true too because fighters are delusional as hell.
100%. You have to be.
We just believe it's going to happen.
You have to be.
And it doesn't always happen, but it's like we know it like it's fact.
100%.
We just know it. And then sometimes you're like, how do we know it was going to happen and it doesn't happen? And we get surprised, and then you have to deal with all that, and there's other things you unpack with that. But there's so much power in that, in the belief, and even the stored memory of the knee. So it's just my knee kind of just being like, hey, don't hurt me again. Right? That little voice kind of like, just be careful with me.
Yeah.
You tore me apart one time. Remember that?
Yeah, it's very, very similar to that. I think that's a good way to put it. And like I said, there's absolutely ways to improve. There's absolutely ways to kind of keep working down that road. And the thing is, most things you would work on to improve that, they have other benefits as well. Like whether it's strengthening or mobility or training movement patterns, it's not just focused on the knee. There's other things as well. So even if it doesn't change what the knee's symptoms are like, you're still stacking other benefits on top. So most folks are like, well, if you don't have any guarantee that my knee's going to feel better or this is going to feel better, why would I even do it? I'm like, well, realistically, nothing has a guarantee, I went to physical therapy school starting it, not knowing if I was going to be a physical therapist, but I paid the tuition and I went through it. And because I put the work in, passed the test, now I'm a physical therapist, right? I didn't know I was going to be one, but I took the risk on it. And it's the same thing with a lot of things. A lot of people don't jump into physically wanting to improve themselves because like, I don't know if I'm going to do it. Well, what's going to happen if you don't do it? I can guarantee that's something that has a guarantee.
That's more scary.
Yeah, that's more scary. The risk there is even bigger, right? So I think that, that's a really good way to put it with the knee. The knees, just remembering, just giving you a little, hey, I'm still here. You know, I still have dealt with this stuff in the past, but not really it's not something to lose hope on because no matter what you do, if you're looking to improve the knee, there's going to be other benefits to whatever you do as well.
Yeah. Okay, circling back one more time to this back thing, the spinal.
Sure.
I want to know what people can do, and I know that you already said it's so vast, and you said that sometimes people improve just by their biopsychosocial changes, just going out and being with friends, and I want people to understand that there is a lot of power in that. But but also, is there a correlation or a causation between being stagnant and back pain? And I'll ask this question because I know, like for my coach, for example, people who've been athletes their whole lives and physically demanded and made the sacrifices you're talking about, oftentimes, we have pain because we have hurt ourselves and we have some trauma and maybe we haven't found someone great like you to help us move through it. But my coach in wrestling, he'll wake up and first thing in the morning, he's stiff as hell. So he doesn't live here, so that's why I know. He comes down and he'll stay with us while, in some of my parts of my training camp, and he's like, I got to go for a jog. Like every time, first thing in the morning, I go for a jog. I mean, he comes out looking like he's 90. Yeah. Comes back looking about his age, which is like close to 50.
Yeah.
And it's funny, but like how that movement can be really powerful. So that's a physical aspect of it. And maybe there's, part mental too. Like, I know if I do this, that I'll feel better. Yeah. But there is truth to that. Like, even if you didn't believe it, I've gone to practice so sore. And the moment that you get your muscles moving and that fluid kind of like moving through your body, you physically feel better. So, people sitting at a desk job all day. Yeah. Good advice to move?
1,000%. I don't think you'd ever have bad advice telling someone to move a little bit more or a little differently, right? So people sitting at a desk job, I think one of the misnomers that's come out of it too is that like people are like sitting is the new smoking. We know that's not true. There's so many worse things that happen with smoking. The risk factor for death and all the things are way higher with smoking than sitting. So that's one thing. If you have to sit for your desk job, that's okay. But you do need to work on the ability to maintain the other aspects of your body. And people are always like, oh, it's just because I'm getting older. It's like, okay, well, let's unpack that.
I love that you're going to dive into this because I know like that is such a common thing for people to just accept as fact.
100%.
Like you have to have a terrible quality of life just because you're getting older. It's going to happen. I was like, no, I don't want that. I refuse that. And there's enough people like you that say the same thing. So please continue.
So when we talk about getting older, like if we unpack that a little bit further, what has actually changed? Is it just your age has changed, or is it everything you do all day has changed? That's usually the bigger driver. It's like, okay, I used to be 14, used to play basketball 5 days a week, used to, lift weights, used to run all the time, used to, have recess in school, used to play basketball in the yard, do all these things. And I felt great. Right? As I got older and older, more and more studying, more and more sitting in the desk, more and more not moving my body. Yeah. And
even get-togethers at parks or with parents, like barbecue, like all the adults sit, the kids play.
Exactly. But when I was maybe in high school, instead of sitting, we used to set up a football game and play, right? So like the choices I'm making now are more sedentary. So I know it's not just my age, it's the choices I'm making as an age, because I know that because I have patients 60, 70 years old running marathons every other month and they feel great. It's because they chose to keep their movement up to a certain level, right? Remember we talked about the body is very conservative. It only wants to keep the things it's really using. That comes with the energy you take in with food, that comes with muscle, anything that is metabolically active, it can get rid of really quick if you're not using it, because otherwise it's just taking energy for what, right? So when you're getting older, if you're gonna blame your age for those things, of course we have statistics, right, that say, hey, every year you get older, past 30, you lose 1% of bone mass or 1% of muscle mass. It's called sarcopenia, all this stuff. I'm like, yeah, but what habits have changed, right? If those people did resistance training and they just started resistance training at 30 years old, I guarantee they wouldn't lose 1% of muscle each year for the rest of their life. They wouldn't.
That's fair.
And that's the thing is like, it's people like to blame things in general, but they don't like to unpack things.
This is a medical system because they want to have, the insurance models and everything. They want to have a reason to just tell you this is nothing you can do about this.
Absolutely.
It's just getting older.
Absolutely.
And here's a pill that'll fix your symptoms. Right.
Well, it's like look at what the insurance system what it kind of prioritizes and what it values, right? If you go get a surgery or get an injection, that's like a cortisone injection or something, insurance reimburses that practitioner quite a bit of money, thousands of dollars. Like some surgeons will get, like for a back surgery, will get like $25,000 reimbursed from the insurance company directly to them, right? Now, if you go to a physical therapist that's looking to prevent these things, that physical therapist, they sign a contract with that insurance company to be in network, like in Vegas, you're going to get anywhere from $40 to $70 for that hour of time that you're working on educating and moving and doing all those things. And that's why when you go to these physical therapy clinics, you don't get one-on-one care. You get one therapist, 3 or 4 other people at the same time that are running around, and you're telling someone, oh, go do the exercise. I'll be right back. And at that point, I'm like, most people that come to us from that system are like, I could just be doing this stuff at home. And I didn't really get the results I'm looking for, right? And that's not the fault of the physical therapist. That's not the fault of anybody it's just a business.
That's not to say that they don't care or that they don't want to make a difference, but their hands are a bit tied.
Hands are tied. Like they're trying to keep this business running. They're trying to grow this business, be profitable, feed their families. I understand it. And insurance companies are dictating care. But insurance companies dictating care is one of the biggest conflict of interest I've seen in this entire country. You pay into this premium every single month to have insurance. Once it's time for you to actually use that, they're fighting back tooth and nail to stop you from getting that care, giving your providers all these hassles and like denying claims, saying, oh, I need this many this many things or items to prove that you need this care. And I understand you want to protect against fraud and abuse and waste and stuff, but like they're literally setting themselves up for failure. Like they consider themselves like the savior, like, hey, insurance will save you once you need something. And then when you need something, nowhere to be found, or giving you a bunch of pushback of saying, hey, this has been denied, that's been denied. And now in the time of need where you need the most help, you're fighting against the insurance company instead of worrying about your own care. And we found that a ton. And I feel like the system values like the sick care once you're actually there versus the prevention. And that's just facts on what we know about what insurance reimburses versus not.
Yeah. And that's why you don't take insurance.
Yeah. So, and like people ask me like, you're just against insurances and like, why are you against insurance? I'm not against insurance. I'm against crappy insurance. And right now, majority of them are really bad. If insurance paid us what we're worth, paid us on time, stopped denying everything, I would take every insurance under the sun. It would make access to myself way easier. I would love to open up access. But for us to give the care to individuals like yourself that really need the help, that possibly we're getting the help somewhere else and not getting the results, for us to give you that care that made the difference between you having surgery in a couple of days versus not, that was only made possible because I was able to give you attention because I knew you weren't going through insurance and we can actually give you that attention. Yeah. So I think that is a powerful story. And I think we see more and more like non-insurance based clinics popping up, which I think is phenomenal, right? I don't look at them as competition. I look at them as on the same team. And the more and more that pop up, the more ability we have and leverage we have to fight against insurance companies that are trying to devalue us while making record profits every quarter. You know what I mean? So like my fight isn't with the people that have insurance, it's with the insurance companies themselves. And I think eventually there's going to be a breaking point because I know insurance reimbursements, even for physical therapists, are being cut every year. And eventually the therapists and the clinics can say, hey, we can't see your insurance. Like, people that hold your insurance, we can't see them because we lose money when we see them. Yeah. And
not able to provide the kind of care that you're going to benefit from either. Honestly, because I've been to conventional therapy, and it's like I had on my hand, my finger, and it would go, and the first like 20 minutes would be like sticking my hand in a heat pad, and then they'd get it some work, and then it would be like the last 20 minutes would be like sticking my hand in an ice pack.
Yeah.
And I'm just like, what are we doing here?
Yeah.
Like, it was that kind of thing. But I mean, as you mentioned, that person's going around and trying to work with 3 people so they can make enough in an hour
100%.
to actually probably help the business be profitable.
Absolutely.
And and in the similar thing though, when I had the near surgery with my ankle and everything after my knee, it's like I've experienced a lot of physical therapists.
Yeah.
And you stand out to me above. I mean, it's a night and day difference. I was like, you have to have a different name because I feel like optimized physical therapy. It's like physical therapy has this idea in most people's heads, and I wish there was a word to describe what you do, like functional medicine.
Yeah,
So I always want to call you like a functional physical therapist or something. To like give that holistic kind of feel because it's very different. When I would go in with you, it's like, how are you doing? What's going on? Like, how are you feeling? Okay, the good. If things are checking the boxes in like those, like you said, that social, psycho, mental and emotional aspect, everything's good. Okay, then we focus on this. But if I'm like, hey, coming in, I imagine as other clients probably come in, it's like, I'm not sleeping well. Then you're like, oh, well, maybe that's the area that's like the biggest problem and it's actually not so physical.
Yeah.
Also, what's unique about working with you when I come in as a client is like, you're not, super hands-on. Like a lot of times when you go to physical therapy, people expect to have someone like work on them for an hour. Like you're going to give me something that's exterior for me that you're going to just like magically transport into me. And then all of a sudden I'm going to be fixed. Right. And I'm not saying that there's no value in like massage therapy or chiropractic or anything. I'm not saying that there's no value. I'm just saying that, you teaching me how to teach myself has been the most valuable thing that I've ever experienced in physical therapy. Yeah.
Well, no, I appreciate the kind words. Those are really great words. I 100% agree. I think with the hands-on stuff, we do it, but where it's necessary. I look at the hands-on work as a regression to exercise. If your body's not ready to move that area, let me help you move it a little bit. Let me give it a window of opportunity where movement becomes more comfortable or feels a little safer. Yeah. And if it feels safer, then the movement's going to become that much more effective for you to learn over the long term. So I agree. I think there's very much like value in hands-on stuff, whether it's just human touch has been shown to be able to decrease pain, right?
Sure.
But human touch can be done in a million ways, right? If I have a specialization in movement, in exercise, in that aspect, I would love to use it in things that have, in that time that I have with you, those 60 minutes per session, I would love to use it in where I can maximize my long-term benefit to you, right? So I think we're in a place now where there's certain times though we do have to meet the patient's expectations. They come in, they might think like, hey, physical therapy is 60 minutes of hands-on work, whatever else. Sometimes we do have to do a little bit and wrap in what they need in like a package of what they think they want, right? And then we have to work that game, and then eventually as education goes along, people like yourself learn about it. Oh man, so this is the most important thing I could be doing is relearning these movements. And I really enjoy that aspect. I really love seeing the light bulb start clicking when people start learning those things. And that brings me a lot of joy, but a lot of fulfillment as well. And it's, I see day in and day out, like that's where people change the most and improve the most. And and that's the same way I train all my therapists. So like all my therapists are like hands-on when they need it and hands-off when it's time to progress and get off the table and out in the gym and doing the things that you need to do. Cause like if you go to the gym, no one's going to hit the bag for you and you get better. No one can lift the weight for you and you get stronger. So how can someone rub you and then you make this long lasting change?
Right. It's kind of like just like the little catalyst to get the momentum going.
Exactly.
And then it's like, okay, now you gotta do the rest on your own. Cause it does have to make sense through my own body to the movements. And I think one of the other things that I've really enjoyed about working together is that I've learned so much about being a better athlete through working with you because of injury, but I don't think it's like I would recommend somebody who wants to be a better athlete, regardless if they're hurt or not, to work with you because or anyone that does it like you, because there's a lot in the way that there's preventative, like learning to move better for your specific sport. I think could be like a prehab, right? You can learn just how to be a better athlete. But also I just feel like my speed and these things have improved, and we're potentially at their best, I think, when we were, working together more regularly.
Yeah.
But that's just another interesting thing that I haven't experienced any other place that I've ever had physical therapy. It's always been very singularly focused on like, okay, this is what we do. And we do the massage, and then we strengthen, and we try to, maybe try to get some coordination back or something. But it wasn't, I didn't have like the light bulb moments. It was like, okay, yeah, this is just like normal.
Yeah.
These are things I do. But like, I didn't have that experience where I was like, wow, I was like, this is going to make me better.
Right.
I cannot wait to take this and go to sparring. Like, for instance, one silly, stupid thing that I always used to have trouble with was with my ankle. Was we always run in a counterclockwise motion around the mat, and I was like, like when we get on the sharper part of the corner, I can't run. I'll roll my ankle.
Yeah.
And you were just like, try just like lowering yourself down to the ground more.
Yeah.
Like you just like, I got more. And it was like, holy shit.
Yeah.
I was like, wow. It was like, that was like so stupid and simple. So I still do that. So kind of like, I just kind of lower myself now to, prevent putting the strain as the inertia is kind of pulling me to the outside of my foot, that sinking down and staying on the inside as I kind of blade my feet to go around is like, it translates into everything that I do. So like if I'm cutting on a wrestling shot and I go from the outside and I need to like be dynamic and moving in, these movements in general carry so much more value to me than just like going in and strengthening something.
Yeah. And that's why the name of the practice is optimized physical therapy and performance, right? Like that performance aspect, it seems like it's the, redheaded stepchild at that last point of the name, but it's really ingrained throughout the entire process. When I start working with you for the ankle, even though some stuff at the beginning was mostly on the table, some hands-on work as we kind of built some stuff out there, the whole intention behind that was performance from the get-go, right? It was never to like, oh yeah, now you're strong enough, now let's go for performance. Like, no, let's work you towards that. Let's work our plan of care with the mindset of wanting to get you to perform at the highest level. And we take that approach to every single person we work with, because whether we work with like a firefighter or a NFL player or WNBA player, whatever we're working with, it's like, okay, you might have some symptoms, but your goal here is to perform better because these symptoms are stopping you from performing, right? And we want to make sure that performance is held to a high standard. And the building blocks of performance come in those small rehab exercises, the strengthening exercises. We want to build on a solid foundation. So the best time to relearn movement patterns is when performance is, driven down a little bit because of symptoms. I can't perform at the level I want. So, okay, that's taking your mind off performance. Let's rebuild these movement patterns, but then always correlate them to performance, because then just like when I'm like studying something out of a book, if I can make contextual clues in my brain, I'm retaining that information a lot better. So when I talk about dropping the center of gravity a little bit to help you find some downforce into the ground, and we translate that over to a wrestling shot or like running around the mat, at that point you're like, oh, now this makes a ton more sense versus I'm just telling you, hey, just drop down a little bit. Okay, so what's the point? How low do I drop down? Like, how often do I do this? When do I do this? And then if I didn't tell you those things, it'd be hard to make those contextual clues. So that's the point of being performance focused. Most people can make those contextual clues a lot more once we correlate that specific movement we're doing to the performance we're improving.
How do people find someone like you in their area? Like, what is it that you do and what's different about the kind of physical therapy that you offer versus the standard model?
The things I would say is, one, if you're Googling it on Google Maps, I would say type in performance physical therapy or performance physical therapist. That's one way to go. But now a lot of people
this could even be for someone who's just like a normal person. Like, you don't have to be a performance athlete. I mean, you could be like literally an 80-year-old woman who doesn't want to fall.
Absolutely.
Right?
Absolutely.
And if you want to move better.
Exactly. If you want that high level care, that's most likely most people that identify as performance physical therapists generally have models that are 60 minutes, one-on-one, build you out a plan, check in on you like outside, even when you're not in the clinic, like those things, like almost like a concierge type physical therapist. Generally, they identify themselves as performance physical therapist. The other thing I would do is look at the Google reviews, look at the reviews they have, right? If you go on the reviews and they're super generic and they're not like really telling a story of improvement and what they've done and everything, generally a lot of clinics buy their reviews. And it's funny.
Really?
Like,
What? I didn't know this was a thing.
Yeah,
of course it's a thing. Everything's
places,
a thing.
A lot of places buy their reviews, and there's plenty of ways to do it. Like you can like offshore some of your reviews on Google. Like there's clinics you'll see that are like big box. I'm not gonna name any names. I might get sued, but they're big box name box clinics that like you look and like, oh, that's typically known as one of the worst quality clinics, and you click on it and it has 500 5-star reviews. I'm like,
Right.
So you're telling me with that many volume of people, not a single person has complained. That's a little, you could tell. And then like you read the reviews, there's one line, oh, staff is beautiful, like clean facility,
right,
this and
right.
that. It's all generic stuff, right? So I'd say look out for that. And then the other thing I would say, when you call in, what's that conversation like? Right? Are they asking you, hey, what's going on? Hey, what have you tried? Hey, where's your symptoms? Hey, what is this taking you away from? What are your goals? Are they asking you that stuff? Or are they saying, hey, what insurance do you have? What's your date of birth? And what's your name? And
when do you want to come in?
When do you want to come in? It's like, that's easy. Those clinics have it on easy mode. They don't have to really build that connection with their patients. So you need to feel the care from the clinician in the office off that first phone call. Stop letting people get away with it. Stop letting people, practitioners, treat you like a number, treat you like you don't exist or you don't matter, by actually getting those questions asked. And if you talk to someone and they don't ask those questions, all they worry about is what insurance you have and how they can bill it. They don't care about if this is even the right fit for you. You might come in, it's not even the right clinic for you. Right? So that's our whole intake process, is making sure this is the right place for that person. And that's why we put that intake process. So I'd say that's a way to go. It's tough to say if they're going to exactly look at movement under the same model we look at it as. But if anybody,
what was there a name for this model?
So
you mentioned the doctor earlier.
Yeah. Bill Hartman, I think he's named the model the Unified Health and Performance Model. Is kind of what he's named it. But there's like some people call it the compression expansion model, a couple of different things, because that's how like fluid dynamics work. They compress and expand. But he was definitely an originator. So I would say that's the name that kind of goes under it. But it's not a very popular name. It's not something that anybody would put in their, in their Google listing or their website or anything like that. So
if you call and you really want to do your due diligence, you could ask.
You could ask. You could ask hey, what model do your therapists prescribe to? And then at the front desk would not be surprised if that person couldn't answer it. Yeah. So at that point, if that physical therapist doesn't call you back directly, you probably want to look for a different spot. Because if somebody asks more specific questions, I make time out of the day to call that person. Even though I have patients, I have this and that. I don't know if I told you, I opened up the clinic in Michigan recently too, like 4 weeks ago.
No, I didn't know you'd opened it, but I remember you bought the property and you were moving on it. Last I was in there. So good
May
job.
1st, we got keys and we're starting to see clients out there. So everything's great. But I have these things pulling me in different directions, but I will always make time for the thing that made us what we are and successful in the space, which is the people. So whether it's my clinicians needing my support, my help, whether it's my front desk needing it, whatever needing it, we always make time for the people. I think that's what gets lost once you become a number and just an insurance card. And I think that's what people should strive for. Do you feel like this place has your best interests at heart? And do you feel that because they're treating you like a human being?
Yeah. Is it also optimize performance?
Yes. Optimize physical therapy performance. Yeah. My goal for next year is open up a clinic in Summerlin.
Okay.
Yeah, because if you know any other good physical therapists, let me know because we're hiring one right now.
Okay. I'll keep my eyes out for sure.
Yeah, please.
Or at least even somebody who's got the potential to learn from someone like you, right? I mean, they don't maybe
they don't need to be amazing right now, but give me 12 weeks with someone that really shows the drive and the confidence and the clarity to get better, and we can turn that person into an expert.
Yeah.
So I'm just looking for someone like
we have a lot of interns come in at the PI as well.
Oh, do you?
So we get to work sometimes with these up and coming starry eyed, happy, excited to work with people. But sometimes it's like you meet somebody and you're like you're gonna go somewhere.
You got
what it takes.
Because some people go in those big name internships and they come out worse. Not because the teaching wasn't right, because they have that imposter syndrome. like, man, like I just had this internship with all these big names, working with all these big people. Like, I don't even deserve to be here, blah, 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 whatever. Kind of like what I was dealing with when I first came out of school. Mine was a little bit more masked with like fake it till you make it confidence, where some people kind of wear it on the outside of like, yeah, I need to get better first type thing. But like, what I'm looking for, I don't care if you don't think you're good. I care if you feel like you're resourceful enough and driven enough to get better. If you show me that, then you're part of our tribe, and we turn you into, from like that, shotgun approach therapist that just tries everything, strengthen and stretch, to a sniper that really understands like the issue going on and what to do for it kind of right away and feel that confidence and clarity. So it's that's the other thing we provide at our clinic. We provide like a ton of mentorship, ton of support, and understanding that like without these people getting better, we're not going to be successful. So we always put so much time and effort into our people.
Right. And I feel like the other therapy places is kind of like they're dragging it out. It's like they just try to keep clients or refer them to a surgeon. Which is just a different approach. So it's a different experience.
Yeah. And I mean, sometimes medicine is medicine. Sometimes surgery is needed, right? But when you look at the research, and I don't know the exact number, but I think it's somewhere around 50% of like spinal surgeries, they deem them as unnecessary, as something that wasn't really.
That's so scary because spinal surgery is a major undertaking and could paralyze you, and you could have all these major complications.
Life-changing stuff. And that's the thing is like, and the thing is like when you're a surgeon, when all you have is a hammer, everything is a nail, right? Like everything, because you're taught that you can fix everything. I'm not talking about all surgeons, but
right.
but people like generally, like, the thing you have at your disposal is surgery that brings the money in, that gives you fulfillment. That's what you train for your whole life. You're going to feel like you can fix everything with surgery. The problem with that is that, okay, you see this person come back for a follow-up, a couple months, couple weeks, couple months, and like probably 4 or 5 times throughout the process. The therapist sees them 3 times a week, 2 times a week, whatever, for the next 6 months. They really get to talk to them. They really get to see, what this person's dealing with. It's not all, sunshine and rainbows. Once you get surgery, you're fixed. There's a lot of process that goes afterwards to build you back up from that breakdown. Because, the surgery was done in good intention. It was done to fix something or repair something. The body doesn't know that. All it knows is it was cut open and finagled with and then stitched back up. How does it know that that was for good? It doesn't have the ability to like, the nerves don't have the ability to come out and look with their eyes and see, it's good.
Just like we have trauma.
Just trauma. It's controlled trauma, but it's still trauma.
Yeah.
So like we have to understand that. And I like I said, I don't like to paint one like modality or one intervention or profession as one broad brush. So I'm not saying all surgeons. I think most surgeons have very, very good intentions. I think the system.
I think most doctors do.
Most doctors, most healthcare professionals. Yeah. Absolutely.
They usually get in it because they want to help people.
Absolutely. And then what's driven towards the decisions that generally aren't for the best interest for those people is when insurance gets involved and like maybe business decisions get involved and like maybe not knowing gets involved.
Yeah.
That's why, because I've made mistakes in my career as well. But I think what makes me feel okay with making mistakes is understanding that my intention was good and pure at that time. And also if I make a mistake, there's no way I make it a second time because I'm learning from it every time.
Yeah. That's amazing. I'll tell you one other quick little story about my sister. She got in a car accident, rolled her car down an embankment, and she had to be hospitalized for a few days. And it was rough. Like they weren't sure, like if she was gonna like be able to walk again and stuff because her back was messed up. And she got through it, but she was told she needed surgery. And I had been working with you already at the time, and I told her, I was like, just get a second opinion because, surgery isn't, and I'm not necessarily saying that was based off of anything that you said,
sure,
but it was based off of my understanding that not everything always needs surgery. And like you said, sometimes surgeons are just like, well, this is how I know how to fix it. If you come to me and you ask me to fix it, this is how I know how to fix it.
Yeah.
And I just said, it's a huge undertaking and it's a huge thing to go through and it's scary and you might not need it and you might not be better for it. That's the other thing about surgery. There's a lot of times it doesn't leave you better off than you were. So a lot of people assume that if I go surgery, I'm going to be better. Johnny had surgery on his elbow and they took out big chunks of, it was bone that was in there. And, he wasn't able to straighten it. So it's like here, like he can get to like there and he can't, it locks. So, he's got, his big scar under here now, and he's, got this quarter-sized, chip of bone and all this. So now he can straighten it to about here.
Yeah.
Like 2 degrees.
Yeah.
More. All that surgery, all that time, it's just like, it didn't produce the results that we wanted. And it's just one of those things that I still wonder whether surgery on my knee was the best decision. I just remember feeling so under the gun to make a decision because I wanted to fight again, and I was up against the clock, and is this aging athlete. And I was like, they're telling me that you can't do your craft without an LCL and a PCL. You can't do it. And I was like, but you don't know me, I was like, I think I can. Yeah. I'm gonna manifest this.
Yeah.
Oh man. So and I'll never know because I decided to go with the surgery, and it put me out longer than I would have liked, and I don't know which one was the better choice, to be honest. But I'm here now, and I did that, and it is what it is. But anyways, my dad's elbow, by the way, is doing great.
Good. Is he doing okay?
Yeah, I haven't even heard him talk about it in forever, so I imagine it's really good. I know that he was, it took some time, but for the listeners, my dad threw like a big heavy sack of something over his shoulder, and he popped the inside of his elbow. I brought him down to see you, and he was like, he's great, and you worked on him a little bit, and just the tips that you give were great, and
good.
I haven't heard him talk about it, so he doesn't complain about it. He used to complain about it a lot, so I think it's fine now. But he also was under the, advice that he may need surgery, and here we are, so that's all those things. Okay, how do people find you, and what are you doing online right now? Are you doing online schools? What's going on?
Yeah, so people find me through Instagram, Zaki Afzal DPT, and then also...
You said that really fast. Say that again.
Zaki Afzal DPT.
Okay.
Yeah, sorry. And then also Optimize PTP is our Instagram handle as well, and then that's our website as well.
We'll link all those in the bio for everybody.
Sure, thank you about that. And then so that's how they find us. And then I am doing like an online mentorship for physical therapists and movement professionals that want to both learn how to assess movement at a higher level and maybe aren't completely satisfied with the way they were taught, or maybe don't have complete clarity on how to help people get better, maybe feel like they're missing something. And then I also, in that mentorship in the deeper levels, also teach them if they want to start their own business and how they started, kind of how I bootstrapped at the beginning and started it up and like kind of built it to where it's at. Because our physical therapists we're going to be hiring would be our 6th. We also have a couple of massage therapists and trainers that work in our practice, and then we have another massage or physical therapist out in Michigan. So the goal now is to scale. And so if you're a physical therapist in the Vegas area and you're looking to, work somewhere and you feel like you got what it takes, we'd love to hear from you. But like even if you're just a movement professional that wants to understand movement a little bit better, I have resources for that online. It's called theoptimizeacademy.com. And it's just like a collection of everything I've learned over the last 10 years into hundreds of hours of video.
Can even normal people take those, or no? Do you have to have some like
you probably would have to have a little bit of level, just because like the anatomical references and everything else is like it's just making the assumption that you've had some kind of like movement training, whether it's even a personal training certification.
Well, I've had movement training. It's just been very hands-on.
Hands-on,
literally
exactly.
moving
It's
other
different.
people's bodies.
Exactly, it's a little different. But that's kind of what we're doing. I'm trying to make as big of an impact in this movement world as we can, whether it's with clinics or with teaching other folks, things like that. Because I really do think that we're on like the precipice of making like a pretty nice global change of where insurance companies realize how much leverage we have as healthcare practitioners and how much more important prevention and conservative medicine and physical medicine kind of is. I think we're close. And by close, it could be 50 years, but I feel like, I feel like we're close.
Probably sooner than that.
I hope so. And I think we're close. I'm trying to do everything we can to push it even faster. And I know linking arms with like-minded individuals is a really good way to speed up, because what they say is like, if you want to go fast, go by yourself. If you want to go far, find a team. So we're fighting an uphill battle against insurance companies and the healthcare system, and the more people join the fight, the better. So that's kind of where they find us and what I'm kind of working on.
I love it.
Cool.
All right. Thank you for your time today.
Of course. Thank you for having me.
Yeah.